Hi and welcome back to another video of Medic Notes. This video will be on orthopedics posting for the knee examination station. So first, by starting, the patient is initially standing upright, and for exposure, ideally only wearing undergarments. First, we look at the lower limbs with the patient standing up. Look from the front, the side, and the back of the knee. So from the front, we look for deformities such as genovarum or genovalgum, any muscle wasting, especially at the quadriceps, any scars, swelling of knee joint, or any skin changes, such as erythematous skin. From the side, look for swelling at the knee joint. From the back, also look for swelling to suggest for Becker's cyst or popliteal cyst, and also look for presence of scar. Then after that, we ask the patient to walk to the other side of the room and walk back to assess for their gait. Next, feel. So with the patient sitting on the chair or at the edge of the bed, we feel the temperature of their knee joints, feel for any crepitus in the knee joints while we passively flex and extend their knees, and also inspect for any inverted J sign when they are flexing and extending the knees. Patella apprehension test, where we push the patella to lateral while extending the knee. So these are the tests that we do with the patient sitting on the chair or at the edge of the bed. Then next, we ask the patient to lie down with their knees fully extended. And now we are looking for effusion at the knee joint. So depending on how much the amount of the effusion is, the least amount, which is around less than 10 cc, the test is called fluid shift test. For cross fluctuance test is around medium effusion, around 10 to 30 cc, whereas patella tapping is for massive effusion more than 30 cc. So for fluid shift test, we milk any fluid from the suprapatellar pouch, push to empty the medial parapatellar fossa, and then push the lateral parapatellar fossa, and look for refilling of the medial fossa. This is positive fluid shift test. For cross fluctuance, we milk any fluid from the suprapatellar pouch, and then push to empty the medial fossa, and look for presence of bulging of the lateral fossa. Whereas for patella tap, we milk the fluid from the suprapatellar fossa and then tap the patella against the femoral condyle and feel for ballotment. So besides that, we can also palpate the patella for the facet and the surface. Other than that, we then ask the patient to flex their knee at a 90 degree on the bed. So we have to palpate these anatomical structures shown in this picture here. So we have to palpate for the tibial tuberosity, the patella tendon, medial joint line, lateral joint line, the quadriceps tendon, femoral condyles, and the medial collateral ligament and lateral collateral ligament. So after that, we move, which is to test the range of motion and the power. So the range of motion for the knee joint would be flexion and extension, and the bracket is the normal range of the motion. Also look for deformity, such as fixed flexion deformity or genu-recurvatum. So for knee examination, there are a few special tests, which include the posterior sag sign. First, we look for this sign. We flex the knee at the 90 degrees and inspect from the side of the patient. So in this picture here, there is a positive posterior sag sign, posterior sagging of the knee joint. Other tests include anterior drawer test and posterior drawer test. This is to look for any tear in the anterior cruciate ligament or the posterior cruciate ligament. Lachman test, where we put our thigh under the patient's thigh to stabilize the patient's femur, and then we hold the patient's thigh to stabilize it. As shown in this picture, the right hand is stabilizing the thigh, whereas the left hand is pulling the tibia of the patient. So you can see, hold the patient's thigh to stabilize it, and then the patient's knee is flexed to around 30 degrees, and then using the left hand to pull the tibia to the front, or in this case, to the upper front. And this is to look for any tear in the anterior cruciate ligament, which will be positive Lachman test. Other than those tests, we should also do the varus and valgus stress test. So we do it with the patient's knee fully extended and at 30 degree flexion, hold the patient's thigh with one hand and using the other hand to apply varus and valgus forces at the tibia. So shown in this picture here. The varus force and valgus force. Push medially and push laterally. McMurray test is to test for any tear in the medial meniscus or lateral meniscus. So to test for the medial meniscus, it is shown in the first picture. So the patient's hip is flexed at 90 degrees, knee is flexed at 90 degrees, and then what we have to do is we externally rotate the knee and apply varus force to the knee, which is pushing medial, and then we slowly extend the knee. So when there is medial meniscus tear, the patient will feel pain during this test. To test for the lateral meniscus, it is similar and just opposite, where it is shown in the second picture. So also same 90 degrees flexion of the hip and knee. However, this time to test for the lateral meniscus, we have to internally rotate the knee and apply valgus force to the knee, which is pushing to the lateral, and then we slowly extend the knee. So if they feel pain, there is some defect in the lateral meniscus. After completing those steps, we can say that we would like to complete our examination by doing hip examination and examination of the neurovascular system in the lower limbs. So that's all for this video. Thank you.